we're going to talk about self-care, and self-care is not just about um, you know, avoiding burnout, but it's really about something that is essential. Um, it's, maintaining our overall health, both physically and emotionally, so that we can function at our best on a daily basis. That requires intentionality and regular effort. And in turn, that helps us manage our stress levels and do well in all areas of our lives. So we can think about self-care as having 5 domains. Those are physical, professional or academic in your case, relational, emotional and psychological, as well as spiritual. These are very interconnected. So if you are struggling in one area, it can impact another domain. And they all work together. So let's start off with talking about physical self-care. What does that entail? So that entails the food we eat, including staying hydrated, physical activity, as well as sleep. And we're going to address each of those areas. Physical self-care prevents fatigue and illness. It supports our focus and our mood. So lots of benefits there. In terms of exercise or physical activity, it is recommended that we get at a minimum 30 minutes of aerobic activity 3 to 4 times a week. And with that, with regular exercise, we see improvements in focus and memory. In fact, research has shown that with regular physical activity, our brain volumes in the areas like in our hippocampus, which is the area that's involved in memory, as well as the prefrontal cortex, which is involved in executive functioning, things like planning, decision making, paying attention. So the volumes of those areas can actually increase with physical activity. Physical activity also brings about an increase in endorphins or our feel-good neurotransmitters, thereby uplifting our mood. It can help build routine in one's life. It can help build connection if you work out with somebody or if you go somewhere, to provide structure and social interaction. It can enhance your sleep. Although I will say that if you have insomnia, then you probably don't want to sleep. You don't want to work out too close to your bedtime. And it can decrease cortisol levels and therefore reduce our stress levels as well. So what happens during sleep? Let's talk about that a little bit. There are different phases of sleep that we cycle through. We start off with wakefulness, then we enter non-REM sleep. REM stands for rapid eye movement. And the reason for that is because our eyes are moving by very rapidly during that stage. So NREM is non-rapid eye movement. There are 3 stages there. N1 is the lightest. N2 is deeper relaxation, our temperature drops, heart rate drops. Stage 3 is the deepest stage of sleep, and it's essential for physical restoration, for immune functioning, and also for pruning, like our neural connections. REM sleep, it is when the body is actually, our mind is really active, but our body is paralyzed except for the muscles that are absolutely essential, like our breathing muscles. It occurs every 90 minutes after falling, starts after about 90 minutes after falling asleep. It's characterized by rapid eye movement, increased brain activity, and vivid dreaming. And dreams are a way of processing our memories, whatever happened during that day, even our trauma. So REM sleep is really important with emotional processing. And it's also important for memory consolidation. So we said deep sleep, it's important for that pruning of the neural pathways. REM sleep, once the pruning has occurred, REM sleep is important for memory consolidation to strengthen those networks. Each full cycle lasts approximately 90 minutes. Typically, we get 4 to 6 cycles per night. REM stages lengthen in later cycles while deep sleep decreases. Deep sleep, we see that more, initially, and then those decrease as we go on through the night. So if you are sleeping less, you're not just decreasing the total percentage of sleep that you're getting, but you might be decreasing the percentage of deep sleep that you're getting or the percentage of REM sleep that you're getting, depending on whether you are sleeping later at night or waking up early. And that can have ramifications on its own because then you're not getting, a restorative sleep. Why does sleep matter? So really, when we think about sleep, it's kind of the foundation of our house upon which everything else is built. And, if you want to live a long and healthy life, get your sleep. Um, in fact, especially for students, if you have the option to stay up and study the night before an exam, or even actually the days before an exam, versus get a good night's sleep on the days before an exam, you would most likely do a lot better if you opted to sleep well instead of use that time to study last minute. So it helps with cognitive performance, emotional regulation. People who sleep less than 6 hours have been shown to be at risk for depression, anxiety, as well as suicidal ideation. Physical health, it helps us stay well. It has been shown to affect vaccine effectiveness. And it supports cardiovascular health, growth and repair. Deep sleep allows for tissue repair, hormone regulation. And so I talked about deep sleep and REM sleep, so I'll go over that again. But as you can see, it impacts a lot of areas in our body. How much sleep do you need? Most adults need 7 to 9 hours of sleep every night. So if you're getting less than that, you are really doing yourself a disservice. Think of sleep as, your ultimate self-care activity. And the quality of sleep matters just as much as the quantity of sleep. All right, so factors affecting sleep. There are lots of things that can affect sleep. It can be age, sleep quality, and even quantity declines as we age. Hormones. We have, a natural circadian rhythm, and some people are just wired to be night owls. It's just built, they're just built like that. And some people are morning larks. So, at times, if there's what we call a delayed phase syndrome, where, you don't get, and teenagers have this kind of built in, that they don't fall asleep. They don't feel sleepy until much later in the evening, like around 11 o'clock or midnight. In those cases, a little bit of melatonin can actually help. And by a little bit, I mean starting at even 0.5 milligrams, going up to, 1 milligram, then trying 2 milligrams, 3 milligrams. Um, and melatonin is a natural substance that's made in our brain, and that helps us regulate our circadian rhythm. Um, Cortisol is another hormone that can affect sleep. Um, Health conditions, if you have pain or if you're really anxious. One tip I provide to students is if you are somebody who worries a lot at night, just tell yourself, okay, like I will allocate an actual worry time during the day, and it doesn't have to be very long. It can be 5 to 10 minutes during the day that's scheduled into your time. And if you're worrying at bedtime, you just tell yourself, I will come back to this tomorrow during my worry time. This is not my worry time. Environmental cues can really affect sleep. So environmental cues including light, noise, temperature, as well as food. Um, and so I put that under lifestyle, but really these are zeitgebers, what we call zeitgebers or time givers. They help our brain, they condition our brain to um, think of sleep with this. So if it's, really bright in your room, your brain is going to think it's time to be up. It's not time to sleep yet.
Chicago's top indoor sports facility.
Same thing with noise. It should be quiet in your room when you're trying to sleep, and it should be cool. The temperature should be cool, around 65 degrees is optimal. Sleep environment quality, if you have a comfortable mattress, that can go a long way. Um, Lifestyle factors, caffeine. Caffeine has a half-life of between 5 and 6 hours. So depending on what time of day you're drinking caffeine, 5 to 6 hours later, only 50% of it has been metabolized. Alcohol, also drinking alcohol close to bedtime can really affect the quality of sleep, and you can have micro awakenings throughout the night without even realizing it. Nicotine is also something that can affect sleep and, cause irritability, cause anxiety, cause insomnia. Food can be another zeitgeber. So if we are waking up in the middle of the night or eating to have a snack or eating too late, too close to bedtime, that can send a signal to our brain that it's not really time to sleep. Stress can affect sleep, our mental health, irregular schedules. Some people have to work late, and their schedule might be messed up. So anything you can do to correct that so that it lines up with your internal circadian rhythm. So if you are a night owl, if you can help it, if you are able to work your schedule in a way that you can wake up later in the morning, that's great. But I know, students can't always do that, neither can employees. So you have to kind of work around that. Okay, so let's talk about sleep hygiene. Sleep hygiene is just tips that can help, um, with our sleep. So, some of the most important habits I would say is consistent. One of the most important habits I would say is consistent schedule. So, regardless of whether you say on Saturday night you go out and you go to bed late, try to wake up on Sunday morning at the same time that you would for school day, because come Sunday night, if you woke up late Sunday morning, come Sunday night, you are setting yourself up for what we call a social jet lag, because you're not going to be tired. You're, not going to be ready to go to bed at the same hour, and you're not going to get enough sleep that night. And it's going to take a few nights to get your cycle adjusted. So try as much as possible go to bed around the same time, wake up around the same time. Wind down routine, like do some kind of calming activity every night. If that could be reading, journaling, stretching. Avoid blue light. So calming activities does not include anything that includes screens, at least 30 to 60 minutes before bed. Limit caffeine and alcohol, especially in the evening. Create a sleep-friendly space, so it should be cool, dark, quiet, and screen-free. And if you want another one, I will say if you're struggling with staying up in bed, you're tossing and turning, get out of bed, do something else until you feel sleepy. Again, stay away from, television or your phone or laptop, or whatever. Go do that calming activity once again, back to bed when you're sleepy. Okay. When to seek help for sleep. So if you have difficulty falling asleep or staying asleep, or you're waking up too early, more than 3 nights a week for over 3 months, then it's time to get help. Also, if you're feeling unrefreshed despite getting a full night's sleep, and by full night's sleep, it depends on where you fall within that 7 to 9 hour spectrum. If you're sleeping the right amount of time and you're still like waking up feeling really tired, then that could be a signal. It's very likely that there's something physiological going on, and you should consider talking to your PCP, talking to, or a sleep doctor. Okay, so let's switch gears and talk about food. Food, it is also, it's like our fuel. So it impacts how much energy we have during the day, how alert and focused our mind can be, how we feel, whether we're happy or irritable or feeling anxious. So some of the strategies when it comes to food is that we should aim for balanced meals, carbs, proteins, and veggies. As college students, it's really hard to maintain a regular meal schedule. So, you can prepare something and take it with you, like on the go snacks that are healthy, fruit, yogurt, whole grain crackers, and stay hydrated. Carry a water bottle that you can refill during the day. Let's talk about sugar. So sugar is very prevalent in our society. In fact, a lot of processed foods add sugars, fats, sugars and fats and preservatives to our food in order to make them more palatable. And they also take out nutrients from the food to increase shelf life. So another reason for you to be mindful. They can also add back some nutrients to the food later on in the process for the conscious and savvy consumer. So if you're reading food labels, they could say iron, potassium, whatever, included in the food label, but that is not coming directly from the food. That has been added potentially later on in the process, so that people buy the food. All right, so the recommendations for the free sugar, they apply to free sugar. That means those that were added during the process of making the food, preparing the food, including honey, syrups, and fruit juice. They do not include intrinsic sugars that are naturally present in whole fruits, vegetables, and milk, and are not included in this limit and do not need to be avoided. So if you're thinking about fruits, veggies, milk, you don't need to worry about the sugars in there. But if you're, grabbing something from the cafeteria, or from a vending machine, you definitely need to see how much free sugar there is in there. So according to the WHO, or the World Health Organization, for the general population, they recommend getting less than 10% of your total daily calories from those free sugars. And that can easily add up. If you are even grabbing, having like two Cokes and maybe an energy drink or like coffee with sugar in it. So the less than 10% of total daily calories and reduce the risk of unhealthy weight gain and dental caries. Now, for people who might be overweight or obese or at risk for type 2 diabetes, or those who have metabolic syndrome, cardiovascular disease, other mental health, other physical health concerns, or those who are actively trying to improve their diet quality, there are more stringent guidelines, and those are aiming at less than 5% of total daily calories. Even the general population, if you follow less than 5% guideline, you can have added health benefits like improved energy, stability, and reduced inflammation. Okay, so let's look at an example. If you have a 2,000 calorie diet, 5% off 2,000 is 100 calories. So that's 25 grams of free sugars. And 10% is 200 calories, and that's 50 grams of free sugar. So 12 cans of soda has about 39 grams of added sugar, or about 150 calories, which exceeds the 5% recommendation. So right off the bat, you have one soda, you are out of that 5% free sugar recommendation. Okay. Glycemic index is a ranking that measures how quickly a carbohydrate-containing food raises your blood sugar or blood glucose levels after eating. So it's measured, from 0 to 100. You don't need to know exactly what it is, but basically some foods will cause, spikes in blood glucose and then spikes in insulin, and your energy will come crashing down. And those kinds of foods have a high glycemic index. Those foods can be white bread, sugary drinks, versus things that have a low glycemic index. They're slower, that you have a slower and more gradual increase in glucose levels. And so you have more stable glucose levels in your body during the day if you eat, things like lentils, fruits, oats, veggies, those kinds of things. All right. How do macronutrients contribute to your calories? So different macronutrients, and this is not to vilify any kind of food, but just to increase awareness of how what we eat contributes to our energy levels and our weight. So fats contribute 9 kilocalories per gram. Proteins contribute 4, and so do carbs. Calorie density refers to the number of calories or energy provided per gram of a substance. And so there are calorie dense foods, or like energy dense foods, like they're high in calories, right? Like from foods that have added sugars and fats, processed foods, chips, candy, soda, versus nutrient dense foods that have a lot of vitamins and minerals and are beneficial. They have beneficial nutrients compared to their calorie content. Fiber has minimal to no calorie contribution, so that's great. And, the tip here is to prioritize foods that are nutrient dense rather than energy dense. Okay, so with that in mind, we have to look at the size of our plate, that the plate size influences consumption. And when you are putting food on your plate, start with the veggies. Half your plate should be vegetables, followed by the rest, which is protein and carbs. Okay, and opt for water over caloric beverages or like soda, whenever possible. Processed foods, as I mentioned before, contain excess salt, sugar, and fat while lacking essential nutrients. Whole foods retain fiber, antioxidants, vitamins. So tip is shift toward whole foods, swap chips for nuts, soda for water, packaged bars for fruit. Benefits of home cooking. I know I'm talking to college students. It's really hard. You guys really don't have time. Whatever you can do to have home cooked meals, and that might be steaming foods or putting them in the oven if you have an oven, or even microwavable food. It's better than eating out. So because you can control that nutrient density versus energy density ratio, and you can reduce your intake of unhealthy additives that might increase inflammation, and excess calories as well. Home cooking is associated with lower risk of obesity and metabolic disorders. And really, I mean, I know that people in their 20s can be somewhat intimidated by cooking, but really you just have to keep a few things at home. Stock staples like grains, legumes, frozen veggies, canned proteins, and it can make life a lot easier for you. All right, so this is a very good website about nutrition. It's called myplate.gov. Highly recommend you trying it out. You can even put in your age, your height, your weight, and your gender, and it will give you like your calories, the amount of calories you need. You can meal prep with that. It can give you recipes. So it's a really good resource. All right, now let's talk about another domain of self-care, which is professional or academic. If you've ever heard of SMART goals, I am a very big fan of those. SMART goals are specific, they're measurable, they're achievable, they're relevant, and they're time-bound. So what do you want to achieve? You can use those criteria to kind of set up goals. So it doesn't feel, you know, too abstract. Organize your time with digital or paper planners, break large tasks into manageable steps, avoid multitasking, so do one thing at a time. Ask for support early, reach out to your professors, reach out to advisors, reach out to UCAPs or the dean's office or whatever you need. Apply techniques like Pomodoro, so that's 25 minutes off, work where you're really focused and then you take a 5-minute break. And don't be afraid to nap in the middle of the day. A short nap, like 20 to 30 minutes, can do wonders for productivity. Give yourself a break when you need to, and you feel much more effective and efficient when you do prioritize rest. Relational self-care. So our relationships can be real sources of strength. They can also be sources of stress. So schedule time for friends and family, communicate your needs kindly, but firmly. Set boundaries and don't be afraid to say no. All right, spiritual care can take many forms. It can be meditation or prayer, spending time in nature, journaling about values or purpose, attending services or reading inspiration texts, practicing gratitude. That has really been shown to help. Mindfulness, too, it can affect a lot of areas of our functioning. Emotional and psychological self-care can include therapy or counseling for support and growth, journaling, setting healthy boundaries, practicing self-compassion and self-acceptance, engaging in hobbies or creative outlets, mindfulness or relaxation techniques, for example, breathing exercises. So here's a self-care reflection activity. I would like us to take a couple of minutes and just think about this. So think about the 5 domains. Which domain am I tending to well? Ask yourself that. And if you have a paper and pen, you can jot it down. Which domain am I tending to well? Am I being productive at my work at the expense of sleep? Or am I skipping meals? Am I not tending to my relationships because I'm so busy? So that falls into which domain feels neglected. So which domain am I tending to well? Which domain feels neglected? And then think about what's one change I can try this week. With these steps, it's important not to try to do everything at once. Making small steps taking small steps can go a long way in making a big impact in our lives. So what's one change I can try this week? So, let's commit to making your own well-being a priority. Because if you don't do it, nobody else will do it for you. You have to make yourself a priority and give yourself space, time, because you are worth the effort. And you don't have to do this alone. We have plenty of resources on campus. We have a 24/7 mental health support line, and that's part of our UCAPs. We have CSD, Division of Mission and Ministry, Dean of Students, Health and Wellness. So this is not an exhaustive list, but definitely we have a lot of resources on campus, so please reach out if you're struggling. Now let's take a few minutes and do a meditation. And that's to kind of rejuvenate before we get back into our busy lives. And I know that life as a student can be a lot. And you have a lot of things that you're juggling, assignments, expectations, emotions. And it's really easy to be hard on ourselves. But hopefully this short meditation is a chance to slow down, to check in and treat ourselves with the same kindness that we would offer a friend. You don't have to get it perfect. It's not about that. Just follow along and give yourself permission to be human. So let's begin. You can close your eyes if you wish, or you can leave them open and just gaze, have a lower gaze. So let's begin by bringing our attention to our breath. Notice the inhale and the exhale. Let your shoulders relax. Feel the support of the ground beneath your feet. Feel the chair under you. There is nowhere else to be right now. There's nothing else you need to do in this moment. Just this moment is what counts. Take a deep breath. Let it out. Now think of something that has been challenging lately. It can be something really big, or it can be something very trivial. Let your hand rest gently on your heart if that feels comforting. Now silently say to yourself, this feels hard right now. Many others feel this way too. May I give myself the kindness I need. May I be free of suffering. May I find peace and joy. Take another deep breath. As you breathe out, imagine releasing tension. Allow yourself to feel held in warmth and care by yourself. Repeat gently, I am doing the best that I can. That is enough. Now take another slow and intentional breath. When you're ready, slowly bring your awareness back to the room. Any questions or reflections? How is that meditation?
I appreciate the comments about not sleeping well at night and whatnot. I've been doing that for years, so I, I think there's some things I can take away to try to make it better.
Excellent. Thank you.
Oh,
Just to echo what Scott said, this was a great session. I got some great tips that I can definitely incorporate into my daily activities.
Thank you. Okay. We have a comment saying meditation was nice. And two chats. I'm doing the best I can, just made me feel a little better. Yeah, it's lovely.
All right. Dr. Pet, can you put your contact information in the chat just in case anyone wanted to follow up with you? Well, with that being said,